Hello everyone, I'm Dr. Juma Vishwas. Today I'm going to present Lynch Syndrome. Before discussing about the topic, please subscribe my channel and press the like button if you like this video. And if you have any questions, you can ask me on the comment box and I will happy to answer all of your query. So what is Lynch syndrome? So it's a inherited cancer predisposition syndrome that's affecting the DNA MMR system. And you can see that this is an autosomal dominant disorder. So if any parents carrying this mutant gene, 50% chance of each child inheriting this mutant gene. And that increase the risk of early onset of colon cancer, endometrial cancer, ovarian cancer, and other cancers as well. And overall lifetime risk for endometrial cancer is 40 to 60% if they are associated with Lynch syndrome. So let's discuss briefly about immunohistochemistry. So endometrial cancer is broadly divided into two pathogenic subtypes, that is type 1 and type 2. But based on Cancer Genome Atlas, they also find out four distinct molecular subgroups in endometrial carcinoma. One is DNA polymerase epsilon catalytic subunit, that is POL mutant, mismatch repair deficient, MMRD, copy number low and copy number high. And each of the subgroups has distinct prognostic effect. So overall, the survival rate is very low in copy number low and copy number high, and is better in POL mutant and MMRD mutant. MMR deficient endometrial carcinoma, it can occur either spontaneously or as a result of Lynch syndrome. And so every woman diagnosed with endometrial carcinoma, we actually offer them to rule out Lynch syndrome. And these are the four panel immunohistochemistry to rule out MMR deficiency. So one is MLH1, MSH2, MSH6, and PMS2. If any woman with MSH2, MSH6, or isolated PMS2 is abnormal with a loss of protein expression, we offer them Lynch syndrome. And also MLH1 or MLH1 plus MSH2 abnormal with loss of protein expression and promoter hypermethylation is not detected, we also offer them Lynch syndrome. However, MLH1 promoter hypermethylation is mainly associated with spontaneous onset of endometrial cancer, and that is not associated with Lynch syndrome. P10 is a tumor suppression gene that is located on the long arm of chromosome 10023, and it's mainly associated with atypical endometrial hyperplasia, and it's also related with early onset of carcinogenesis. P53 mutation is located on the short arm of chromosome 17, and if any cancer with P53 function lost, this cancer has a very less chemosensitive and also have a very poor prognosis. BRCA1, BRCA2 is very unlikely associated with endometrial cancer, and however, it shows that only 30% of the cases is associated with endometrial carcinoma. So if any patient diagnosed with Lynch syndrome, we offer them screening every yearly from 35 years of age with transvaginal scan or hysteroscopy and or endometrial sampling. We also teach them that if they have any abnormal vaginal bleeding, they need urgent medical attention for suspected endometrial cancer. Other than that, we also advise them to maintain a healthy lifestyle like weight loss if their BMI is more than 30. They can also do some exercises as because they are also having a risk of bowel cancer. So they also need a bowel cancer screening. If their family is already completed, they need a risk-reducing operation, that is prophylactic hysterectomy and bilateral salpingo-oophorectomy. But based on their carrier of the genes, mutated genes, the age, from when we offer them, that actually differ, like MLH1 and MSH2 carrier from 35 years, MSH6 carrier from 45 years, PMS2 carrier is from 50 years. So that's all about Lynch syndrome. If you have any questions, you can also email me, and this is my contact number. You can also contact me. Thank you for listening.